Dr. Luna, we are living in a time where we are having an obesity epidemic. This is affecting the United States, Mexico, and especially is affecting the Valley. How this obesity and the complications are affecting the presence of diabetes, and can you describe to us the burden of diabetes among the Rio Grande Valley community?
In truth, having the pleasure to be able to practice here, being homegrown myself from Edinburgh, Texas, born and raised, definitely we have definitely seen the epidemic coming from obesity stance, in addition to just the myriad of different factors. Aside from it, we, jokingly aside say the Valley Triad and the Valley Quad. And what do I mean when I say these words? Triad is somebody with diabetes, hypertension, dyslipidemia. Quad is somebody who's had a heart attack or a stroke in addition. But yet these measures, these comorbidities need to be addressed. And a lot of the time, it's the confounding factors of what it does to the body, right? Not only just with obesity alone, but when we think about diabetes, we're a very, very strong cultural Hispanic, Mexican-American community. But in addition, we're growing into a melting pot. I can tell you from when I've grown up, in the 80s all the way up till now here in the Rio Grande Valley, every time I come home, it's always something different, except for the last, 5-6 years I've been here permanently. And, with becoming a melting pot with more ethnicity, more culture, but still, we have great food down here, fortunately, but unfortunately as well. But what we're starting to find is the body's ability to be able to lower down that blood sugar, right? With obesity comes insulin resistance, our body struggling to maintain the blood sugar control that it's needed. And then when you tie into genetics and also other comorbidities, aside from that, it makes it a very challenging aspect. And much of the time too, when you also put, the demands in the medical care, right? You think about when you go to see your primary care physician or your specialist. We have a large community down here. And when we don't have the same availability for healthcare professionals, we're trying to see as many people as possible and make those right choices. Then sprinkle in a little bit of the complications or the difficulties with our insurance companies really is what makes it a pain in the neck. And so I think, the forthright, effort to being able to handle this change. Life has changed in the last 40 to 50 years. And what we're starting to see is those, more and more of these complications occurring, but being able to get that message across to say to patients and to family members that it's okay if potentially you have high blood sugar. Yeah, go see your primary care physician. Try to get in, to your endocrinologist, etc., to be able to tackle this earlier. And one of those things that we have to overcome, in the setting of not only just the obesity epidemic, but also that initial denial, right? That, my sugar is finally crossing that point that it requires, more intervention, yet I'm afraid. Don't be afraid to go see your physician. We're here to work closely with you to be able to help and mitigate those symptoms as well, too.
What are the risk factors to develop diabetes? And if there is any current guidelines, if I, as a member, should I be screened or not for diabetes at this moment, at this age?
That's a great question, right? Because when we look about, what are these risk factors that we need to be, prepared for? First and foremost, looking at your family tree. Something as simple as, mom and dad, grandma and grandpa, etc., they've struggled with their blood sugars going forward. That's one thing to be able to talk with your primary care physician, talk with your specialist about being able to get treated. But more importantly, what are some of the things to be looking out for aside from having a machine at home and being able to test, right? Because not everyone readily is going to have something to test with. And when we get to it a little bit later in the prevention and treatment, there's new innovation. One thing that I feel that we pride ourselves as physicians, and bringing these resources down the Rio Grande Valley is being innovative, being up to date with the current literature to be the best for our patients. But for example, if you're starting to feel when you eat a meal, perfect examples. I saw a patient today who was like, no, doctor, I think I'm having low blood sugars. I said, what do you mean? She goes, well, when I eat a meal, specifically, sweets, I start to feel flushed afterwards and I don't feel well. And I told her, have you ever thought about the caveat to that this might actually be high blood sugar and not low blood sugar, because the body's not going to feel well. If you start to feel sleepy after you eat, maybe some flushing symptoms, just not feeling well overall, this is that sign or symptom to think about, do I have high blood sugar? The bigger ones being, feeling that you're peeing all the time, you're losing weight rapidly without even trying, or you're feeling just ill throughout the day. And it's, interesting, but because I think the guidelines have changed and they're continuing to be progressive, because before it was like, okay, if you're above the age of 50, 55, then it went to 40. Now we're screening people 35. My youngest patient with type 2 diabetes, the youngest patient I've ever seen, 5 years old. 5 years old with diabetes. This happens, right? And of course, yes, and that's in the pediatric realm as well too. But as an adult, I commonly help take care of patients 14, 13, 12 years old with type 2, not type 1 diabetes,